Good morning, everybody. Thank you for joining us. Mayor Greg Fisher here in Louisville. We provide these COVID-19 updates because clearly the virus is still with us. We went through a period of a relative lull compared to the rest of the country, but the virus is clearly coming back. It represents a real danger to the health of our city and the state and our country. So we don't have just our challenges here, but we have challenges all around the United States, especially the South and Southwest. And we're going to do everything we can to make sure that surge does not take place here in Louisville. But we have seen a surge here over the last couple of weeks where we've been seeing week over week percentage increases of 30%, 40%, 150%. Obviously, you don't want to see that down south and southwest. They've been seeing doublings of cases every 3 to 5 days or so. So it's a different type of surge and spread, but now our job is to make sure that does not happen here. And part of that is keeping everybody informed about what is happening. We don't just have the health problem here, but we also then have the follow-on economic impact of that, employability that comes with it. So the health of our economy and the health of our people are intertwined. So we've got to just make sure that we're taking care of this pandemic issue so everything else flows out of that in terms of good health, good safety, and a good economy. The virus is starting to spread throughout Kentucky and in Louisville at a rate that we have to stop. It's moving toward a place that is getting more dangerous. And so that's why yesterday the governor announced that due to Kentucky's painfully high number of cases recently, for the next 2 weeks, bars will have to close once again, and restaurants will have to go to 25% for in-restaurant capacity, not outside, but inside. So bars closed for 2 weeks. The data indicates that bars are places where these are spreading, and we've also seen that in other places around the country. So we've got to interrupt where this virus is. We have to do that for the health and safety of our city. I certainly support the governor's decision. I wish it didn't have to take place. The inconvenience and pain I see when I talk to people around this is real. The virus doesn't care about that, so we've just got to focus everything on defeating the virus. We have that under our own control so that we can learn how to manage with this thing better than what we have been able to show here these past month or so. The governor is following guidelines that have been issued by the White House. Yesterday, I spoke with Dr. Deborah Birx. She's the White House coronavirus task force coordinator. Talked to her about the steps that we had been taking. She is communicating with cities and states like ours that are not to the point where many of the states are that just have gotten out of control in the South and Southwest, just saying, we don't want you guys to get to that point. Obviously, that's been our goal all along, but there is interest in this area of the country now to stop what's happened to the South and Southwest. So I just want to say, too, I am sorry to everybody. All of this is taking place. Oftentimes, people are looking to blame one individual or say somebody else should be doing something else. The bottom line is we are all in this together. This is a science-based problem that we have based on what this virus is doing. And I wish that we were not having to take these measures to narrow down people's activities once again, but we have to. Otherwise, there's going to be more suffering. There's going to be more death that comes with this. And there's something that we can do to control it, right? So until we see everybody walking around with a mask on, we still have got work to do in terms of controlling this virus. So that not only makes sense from a medical standpoint, it makes sense from a humanity standpoint, a compassionate standpoint as well. Wear a mask, keep social distancing. This kind of pause and pullback did not have to happen right here in Louisville if everybody had played their part in controlling the virus, but not everybody is doing that. So let's please, if you haven't been, let's come on board, okay? We need you now to help our city's health, to help our city's economy. The job you may have or somebody else have might be endangered with this. So we really need everybody to please do the right thing. This is on all of us. We know what works. Again, masking, separation, hand washing, stay at home. Virus transfers from people to people. So the more you cut that out, the better off we're going to be. And the sooner businesses can reopen, the sooner we can go back to sports, the sooner we can just move forward as a city in general and keep our hospital capacity at safe levels. That's what we want to make sure that we keep our healthcare facilities so that they can take care of people when they go there. So we just got to take care of business with these fundamentals once again so we can turn this around. All right, let's take a look at the data. As of today, we've had 6,452 COVID-19 cases in Louisville and 244 deaths. That's 156 new cases. We're reporting 8 deaths today. Since yesterday, I want to emphasize those deaths have come over a 4-day period. So there's just been a reporting problem here. And so regardless, if you are a loved one of any of these deceased, it's a tragedy. Okay, so, but this is not a 1-day incident. It looks like it's 4 days rolled up. Dr. Moore, it's either 3 or 4 days. You can correct me on that. In any event, it's a tragedy, okay? And when you take a look through this, you see our demographics again are leaning toward our older population. But remember, we've also seen on these briefings younger people that are passing from the virus as well. So this virus is affecting and can affect any age group in any demographic. Also, to date, we've tested 88,762 people in our city. Of the 6,452 who've tested positive, 4,198 have recovered. Our positivity rate is 7.27%. So that's that rate that we're watching very closely to understand when this starts getting up, if it does start getting up closer to 10%, that's basically when you've got spread that's almost out of control. So we got to do everything we can to keep it underneath of that rate. Okay, and we know, as was reported last week in the University of Louisville's Co-Immunity Project, the numbers that we've shown that are positive, U of L's estimates, and you see this in other estimates around the country, we could have 4 to 6 times that many people that have been infected in the community. Lots of asymptomatic infection. In other words, people don't know they have the virus, but that asymptomatic spread is what we've really got to make sure is stopping. People don't think they have the virus, they're out and about, but they're spreading the virus. Okay, first responders. Overall, we've had 74 of our first responders tested positive since this crisis began. As of today, 63 of them are back at work. The rest are recovering at home. We appreciate the work our first responders are doing throughout all of this. They've been really busting it. At Metro Corrections, we've tested 2,335 inmates, and we've seen 39 positive tests. Okay, so relative to other jails and prisons around the country, we've done a nice job there at Metro Corrections, so thank them for their protocols. Before I pass this to Dr. Moyer, remember when we all started this, how we were supporting restaurants with takeouts and gift certificates and such? I understand some of that has dropped off as people have gone inside and less gift certificates. Our food scene, our restaurant scene here is one of the best in the country and really represents kind of the vibe of who we are. And when you put that together with our bourbon tourism and you have bourbonism, that's something we're going to have once we get through the other end of this thing. But we've got to help as many of our restaurants survive as possible as we go through here. So please remember, order takeout, leave a big fat tip when you do that so you can support our friends in the restaurant industry that have really helped define so much of the soul of our city here and our uniqueness. So let's continue to support businesses that are impacted by this virus in non-traditional ways if we can't do it traditionally, okay, and the people that work there. All right, I'm introducing Dr. Sarah Moyer now. Dr. Moyer is our Chief Health Strategist and Public Health and Wellness Director for the City of Louisville. She's well known to everybody on these calls. Dr. Moyer.
Thanks, Mayor. So our COVID case count in Louisville is rising at an alarming rate. We've gone from having 40 cases a day in most of June to over 200 a day now. The number of new cases per week has doubled every week since we started July. And we know we still aren't identifying all the cases in the city. The cases are rising in Kentucky and Louisville at such alarming rates that Deborah Birx, an immunologist and coordinator of the White House response to COVID-19, came to Frankfurt on Sunday and met with us yesterday on how to give us recommendations and how to prevent our spread from reaching levels like those in Florida and Texas. And the great news is we know what works. Many people, including Dr. Fauci, Dr. Birx, Dr. Sack, Myself and you in the news media have been carrying the message for weeks that there are simple but powerful things we can all do to stop the spread. Wash your hands, wear a mask, limit your contact with others as much as possible, and social distance and stay outside when you must be around other people. I think people are tuning out these messages, and it's unfortunate because we have a quickly spreading wildfire on our hands and people seem to be oblivious to the flames. We need every person to use every resource they have to douse the flames of the wildfire, to stomp out every burning ember. Each of us has to fundamentally rethink the way we go about our lives. We can't be normal right now. We simply can't have our pre-pandemic lifestyles. To stop the spread of COVID-19, we must reset our expectations. We have to come to terms with a new way of living. We need to think through how we as individuals, families, businesses, and as a community member can interact as safely as possible and respect one another by taking the prevention measures very seriously. If we don't, we're going to see more and more people experience serious illness or death or long-lasting health effects from having COVID-19. These risks are not just limited to our most vulnerable, but will occur even among healthy younger people. We need to respect one another by taking prevention measures seriously as a fundamental part of community life and not an afterthought or a burden. We need to interact safely with one another because if we all work together, we all will get through this together. So thanks, Mayor. Back to you.
Yeah, we got to get to the point where everybody can give that speech you just gave, and where everybody can say, okay, what are the things that we can be doing? Masking, social distancing, washing hands, staying at home, and then also the theory on how to box in the virus, which we'll talk about here in a little bit. I'd now would like to introduce Connie Mendel. Connie is the Deputy Director for Louisville's Department of Public Health and Wellness and oversees much of our business operation to make sure that they're safe and they're healthy. So, Dr. Mendel, I'll just ask you a few questions on share a little bit about the data to support the decision to close bars that the governor issued and what we know here locally.
Sure. So to begin, there's several aspects to the data, and we look at the decision to close bars within the state. So there's the national data, as those states that have far worse increasing case counts than we do, how those cases and clusters are related to bars and restaurants. And then cases in Louisville that have been associated to, unfortunately, bar and restaurant employees. As our staff and Lacuna interview people who have tested positive, they identify recently visiting bars locally and while on vacation. That seems to come up through those interviews. And the numerous complaints that we're receiving regarding bars and restaurants. So as of July, we've received over 400 complaints or concerns from Louisville citizens regarding unsafe practices, and over half of those were on bars and restaurants serving food. So that doesn't include markets or other, food retails. Those are specifically sit-down restaurants and or bars. So as we investigate those, we've issued over 38 orders, and those are orders for corrections. Those are not citations with fines, but so those 38 orders specifically to, our restaurants and bars. And just the nature of bars themselves, unfortunately, they're social. That's the intent. That's, why we frequent them. We like to be shoulder to shoulder, particularly at the bar. So just the nature of those operations are contrary to social distancing. And then you add a little alcohol, and as the evening goes on, we get more comfortable. They tend to be loud. We enjoy the music. Louisville has a just fantastic music scene. So we have to, as we sing or we speak very loudly to communicate inside of bars, social distancing is not part of that. And also, our largest increase in cases is among 20 to 44-year-olds in Louisville, and that is the age group that's most likely to frequent our bars. So, it's just difficult to wear a, face covering. And again, the consumption of alcohol, we get more relaxed, we let our guard down. And particularly as it gets late in the evening, that's where we see the overcrowding and the relaxed practices.
So what kind of work are you doing with the bar owners and local restaurants? This is a 2-week shutdown. What do you anticipate will change in 2 weeks, and how receptive are the owners to your messaging when public health visits them?
Yeah, the owners and operators have been extremely receptive to our staff. And we've, attempted throughout their reopening to visit, to call when they're less crowded, and provide guidance and just options for seating and way to spread things out and messaging and signage. Our staff has delivered over 2,000 reusable, washable face coverings, face masks specifically for the food and bar industry staff. And Louisville Metro ABC officers went out last Friday and visited 52 bars providing guidance. So we just attempt to partner with those facilities and continue to be a resource and provide guidance and encouragement for safe practices.
Okay, thank you. Are there any best practices out there that if you're pointing people to from a restaurant or bar that's saying, okay, these guys are doing it the right way?
Yeah, we actually had our staff along with ABC staff out over the weekend, and I have a list of areas, but they saw just great practices. I'll give you some examples at Brownies, the Shed on Lynn Station, the Golden Nugget in Hikes Lane, Manhattan Project on Frankfurt Avenue, the Tin Roof on Shelbyville Road, and Great Flood Brewing, along with Mike Lennings. So several examples. I know our Bardstown Road Inspector visited 50 places. He just went door to door, just checking in, and saw some really good practices. And those that he didn't, we issued some orders and we had directions, and again, they were receptive to those. So the operators, I think, are doing their very best. It's on the patrons. It's on us. We have to do our part to enable those businesses to operate safely.
Yeah. No, I mean, it just kills me, the folks that are doing it right, that now they're shut down for 2 weeks. And because it's hard to run a business in the best of times, much less right now. So come on, everybody, let's do our part. Okay, if the patrons, if the owners, if everybody does their part, we'll get through this. But we've got to step it up a notch here. So let's get back to those practices. So thanks, Connie. I know you guys got your hands full right now. Appreciate it. Let's switch over to Karen Handmaker. And I don't know if in the control room, if you've got that box it in chart, if we could throw that up on the screen. I know I'm just throwing this at you right now, but if we have that, we can put that up there. And Karen, if that comes up on the screen, we can remind people of what it is that we're trying to do with the virus so it does not spread. So Karen Handmaker, a great citizen and our contact tracing coordinator, is helping us to make sure that we're tracing the spread of the disease and making sure that we're boxing in the virus. So just to remind everybody, what we'd like to be able to have is everybody in the community be able to talk about, mask, social distancing, hand washing, stay at home, 4 keys, right? We're doing that because why? We're trying to box the virus in. So this graphic talks about what we're trying to do. Number 1, test widely so we understand where our positives and we understand where particular hotspots are. And then we want to put all of those folks in quarantine so that they're not spreading the virus. On top of that, and this is what Karen Handmaker is going to talk about, we want to find everybody who's been in contact with the infected patients so that they're quarantined as well. And by doing that, then you stop the spread of the virus. Okay, and that's obviously not what has been happening now over this last month as the virus is spreading in more. We have not been successful in boxing it in the way that we need to. And we want to do that so we can get back to somewhat of a regular life, learn how to manage living with this virus. So that's another one of the key simple principles behind that. So Karen, you've been working with our partner Lacuna Health to launch a new hotline for people who've been tested for COVID-19 and are waiting to get the results. So can you bring us up to speed on that and anything else going on in the contact tracing world?
I'd be glad to. Thank you, Mayor. I want to say, first of all, around the box it in strategy, it is exactly what we're trying to do, but we all would love for contact tracing, for example, to be able to shut down. But we can't shut down until everybody does all of the upstream things that we can do to prevent the virus, including all of the things that Dr. Moyer was saying and the mayor saying to wear masks, wash your hands, social distance, and be mindful that our behaviors don't just impact us, but impact everybody in our whole community and our ability to go back to what we all remember as normal life. So for contact tracing, in the meantime, we are, to support the surge in cases, we are now doubling the staff at Lacuna Health. And the next class of folks is going to start their training next week. So we are glad that we could do this and do it so well, and are continuing to get a fabulous response from people who want to do contact tracing. So we will continue to add and grow our contact tracing teams as we need to, as test results show that we have more cases to trace. And in the meantime, though, I want to offer information about a new inbound line that Lacuna Health has set up for Louisville, for Louisville Health. And we are making this available because there's so many people who have lots of questions and concerns about what to do before they go get a test, after they get a test. And we want to help everyone be able to get the information they need as soon as possible. So, for example, you can call us 24/7 and speak to either a contact tracer or a nurse when you have had a positive test and you haven't yet had a call from Lou Health to help you through the contact tracing process. So you don't have to wait. If you've had a positive test, we will help you. If you are a contact of someone who has tested positive and you haven't yet heard from us, you will be able to call us and get the help you need. Also, if you are waiting anxiously about your test results and you don't know what to do, and maybe you're not feeling well, or maybe you are worried about the people that you live with or work with, we will help you. If you are having symptoms, you need to also call and speak perhaps to the nurse or one of the contact tracers to help you understand what you should do. And finally, there could be lots of other questions that occur to you or the people you work with and live with, or go or thinking about going out with to try and enjoy going back to what we used to do to socialize. We want to all do it safely. If you want advice on that, you can also call the inbound line. And in the meantime, if you do get a call that shows up on your caller ID from Lou Health, please know that is Lacuna Health calling you to help you through the contact tracing process. Thank you, Mayor.
Okay, Karen, are you having any particular challenges with the contact tracing processes you'd like to share with us and ask for help with?
I think in the main, we are still getting great cooperation from the people that we reach. And we are reaching more and more people. Having said that, we would like a lot more support from everyone to answer the Lou Health calls, to use this inbound line, to tell us when you are having challenges, even after you are isolating or quarantining, even though we are calling you every day as well. So we just want to be able to be there to help everyone manage the process of knowing when to get a test, and once you get a test, what to do with the results. And if you are a contact and you're worried about how you should be, what you should be doing to take care of yourself and your family in the meantime, you're worried about what your employer might say, you're worried about what your friends and family might be concerned about, we can help you with all of that. So please use all the resources that we are putting out to help you.
Good. So the message on that is we have resources in terms of medicine, food, housing that we can help people with.
Absolutely, that's true as well. Thank you for bringing that up as well.
Okay, great. Okay, let's go to some of the questions here we've got from the media. Hello, Deborah Yetter. She's asking, did we meet in person with Dr. Birx, or was it a telephone conversation? And can you elaborate on any recommendations she had? Excuse me. Yes, Dr. Moore and I communicated with Dr. Birx via phone with a couple other mayors and public health directors from the southern region. I think there were 4 or 5 of cities represented on the call, and she basically was just providing her observations on what they and what we have learned from the massive spread that's going on to the south and southwest of us, and the kind of preventive measures that we could take now to arrest that. Obviously, one, mandatory mask, which we're already have. Two, closing bars, and three, getting indoor restaurant capacity to 25%. Those were the three immediate messages on top of that. Dr. Moore, would you like to elaborate in any way?
Yeah, I just want to add that we definitely met by phone. I like to practice what I preach here on these news briefings, and anything that could be done virtual, I like to do as well. And I mean, just to add to that, I mean, she just really emphasized how contagious this really is, and that how if you've been out in social gatherings, if you had a house party and had people inside and closer than 6 feet apart, just to make sure that you quarantine yourself for 14 days before you go back to work or go to visit your parents that might be older. And so even though you might not realize you have it, it's just really important that we're taking all those precautions and doing all those things like wearing masks and washing our hands and making sure we're staying outside and 6 feet apart. And so just trying to make sure everyone in our community is hearing that message and following that.
Okay, I'll throw a few questions at you, Dr. Moyer. How have testing issues at Norton and Kroger closing test sites affected overall testing in the city? And how are testing shortages affecting contact tracing efforts in the city?
Yeah, so testing is supply chain is getting more difficult. We are still doing way more tests than we were even last month, but because of the rise in number of cases, the rise in number of people have contact with, the rise in number of people not following best practices and going out into social situations, the more people that need to get tested or want to get tested. And so, yes, I mean, it's affecting it. We're seeing tests take 7 to 10 days to come back, which makes contact tracing not possible or feasible. And so it actually makes it seem like why it was a test even worth doing in the first place. So, I mean, it's back to some of that same messaging we had in March. If you are a close contact to somebody who has been confirmed as a case, making sure you are staying home for those 14 days. You do not have to get a test to find out at those 14 days. If you don't have symptoms, you are clear to go out into the community again, but still practice those same precautionary methods. If you don't have symptoms, but you were doing something risky, like if you could just quarantine for 14 days, that's the best thing. The testing is helpful, but it's not the end all be all for us to stop the spread of the pandemic.
Okay. Tori is asking, can you speak about concerns expressed at the State Fairgrounds is hosting the Street Rod Show next week, and the thousands of visitors come from that, and the Kentucky State Fair? Are you worried about the spread of COVID among these groups? You know, I'll take that. The Street Rod Show it does bring thousands of visitors to town. They have to be compliant, right? They have to be doing what we're asking everybody to do with this in order for them to have a safe event. This goes into that category of, can we get back to learning how to manage the virus during some type of the situation we're in right now? We're pointing to Louisville City soccer games as a way that we're showing that we can gather that. Now, we don't have the data yet from any type of infection that could have spread there. We don't know of any, but if you are disciplined, there are ways to do these things, but you have to be disciplined. So certainly we're concerned about that. And then as it relates to the state fair has been radically altered in terms of the design of it. The governor has spoken about, as we get closer to these events, we're going to have to be making some game time decisions relative to the state fair. So what we've got to do in the meantime is do all these precautions we're talking about so the numbers start going in the other way. Anything else from you on that, Dr. Moyer?
No, I just think the people running both of them are aware that things might have to change depending on what happens this week, and would hope that if anybody's coming from out of town, they're following the same recommendations that we're doing, that they're quarantining for 14 days before they're closer around other people. So hopefully everyone is following those recommendations, and the health department will always try to make things as safe as possible if they occur.
All right. So thank you for that question, Tori. Marcus Green. Hello, Marcus. This is a question for Karen. Is Metro government getting enough and timely data from the contact tracing program to make real-time policy decisions?
Thank you, Mayor. And yes, we are working hand in hand daily with Lacuna, looking at the data. We are also looking at data from the state contact tracing and tracking system known as ETC, and we are combining that information to make our decisions. So, for example, we're depending on this information to not just the number of cases going up, to know how we should begin to hire more people to take care of the surge in cases. We are working very closely, as I said, with Lacuna and also the state to develop the data we need to make timely decisions.
Okay, thank you. Sarah, on this one, this is for Marcus too. Do people have legal protections if they quarantine for 14 days after being notified by a contact tracer and have to miss work? I don't know, Karen, you might know that as well. I can say that's certainly our expectation, but go ahead.
Yeah, I mean, I hope most workplaces do offer paid sick leave and provide emergency protection for that. If not, I guess let us know and we will help advocate for that. I know some states have made broad statements that you can't get fired because of COVID. So hopefully people feel protected. If they don't, they're talking to our contact tracers and our disease investigators so we can help in those situations.
I would just like to add to that, Sarah, that, that think that the people that we're most concerned about are people who might be part-time or contractors or don't have benefits, so they don't necessarily have FMLA or they don't have health insurance or vacation time that they can use when they do have to quarantine or isolate. So those are the types of situations that I think are going to require more advocacy and other support.
Thank you. Lexi Ratterman is asking, when we talk about new cases, does that number include people who have previously tested positive and are retesting and still positive? In that case, can we really call the daily numbers new? Dr. Moyer?
Sorry, I was responding to another one. So new cases, no, they're new. The number of new cases is new cases. So sometimes you'll see our numbers jump and then like go back down. You'll see the governor report the number of new and then taking out duplicates. So these are individual people, and sometimes we have to recalibrate the data to take out those repeat people. So the number new is the number of new people that are cases.
New individuals. So if I've been tested 3 times, I only show up as one?
As one, yeah.
All right. Yep. Thank you. Laura's asking, should everyone get tested regularly or should tests be saved for symptomatic people and frontline workers?
So in an ideal world, we want everyone to get tested regularly. There's 2 different kind of tests out there too. So the diagnostic test, that's that nasal swab test, works better if you have symptoms or have a really high chance of being positive. So you have contact with somebody who was a case and are getting tested like 5 to 7 days after that. So that's ideally what we want to use that test for. There are more methods that are coming available to how to do more surveillance and like insight testing in the community, how to do more screening to make sure that people aren't bringing COVID into our nursing homes or schools or workplaces. And so I think those tests are coming more and more available and are getting better with that. So right now, because there's a shortage, because it's taking too long to get tests turned around, we need to be making sure we still have enough for everybody with symptoms and close contacts to cases to be getting tested.
Tori is asking, and this question comes up a lot, is there any discussion to again offer COVID tests to protesters at Jefferson Square Park? And is there concern about spread amongst protesters?
Anytime you're in a close contact situation, don't have a mask on, there is risk of spread. We have plenty of community sites available across the community, and just encourage anyone who's at risk for whatever activity that they did, protesting or other things, that they go get tested at other sites, especially if they have symptoms. We want them contacting their healthcare provider to get tested. And then if you are going to have to see your parents that are older or working in a place that has a lot of patients that are high risk, definitely recommending that 14-day quarantine before you go back to those normal activities.
And we're not, the early stages of the protest, we had a lot more people, higher volume of people down. So we could have better usage of the testing capacity down there. So that's been a change. Remember, the virus does not spread as easily outside as it does inside. But regardless if you're protesting or not, you should be wearing a mask. So this question comes up a lot about protesters. Have we been able to see anything from our contact tracing, Dr. Moyer, that would indicate to us that we're seeing spread amongst protesters? And would we expect that type of granularity with our contact tracing?
Yeah, so when we look at the data, less than 10 of our 6,000 cases have been linked back to protesting. So when you do a big comparison of everything else and all the other risks, it's small in comparison of our bars and our travel and our restaurants, our workplaces where people are inside and closer together, or camps or fitness centers where people may not be able to wear a mask and are breathing hard. So definitely other activities that are more risky, but it's not 100% safe.
Also, when you look around the country, Tori, and you see there's been some large protests, let's say in New York or Chicago, there was not a bump in positives after those. So again, it's outdoors, but if you're protesting, please wear a mask, okay? Because some people see this as like double standards where they're being asked to wear a mask, but protesters are not. The more we can all be in this kind of health effort and human effort together with masks, the better off it is for everybody. And then last, what's the current state of hospital capacity and daily hospitalizations? That's from Marcus Green.
Look at the data. We have about 90 people hospitalized across Jefferson County with COVID right now, and that's an increase from about 50 to 60 that we had the most of the month of June. So hospitalizations are increasing. They're nowhere near capacity, but something we are keeping a close eye on because we know hospitalizations increase 2 to 3 weeks after like an increase in case count. So that we're following that, and hopefully people will hear our message today and help us turn that curve around so we don't see that surge in hospitalizations that other states are experiencing.
All right. Well, thank you to our public health team. Thank you to the citizens of Louisville. Let's rise to this occasion so that we can beat back the virus, get it into a more manageable standpoint, get our restaurants and bars back in capacity here in 2 weeks so that we can demonstrate we know how to manage living with this thing. And if everybody, if you have not been distancing and masking and doing all those, please make this be the first day that you do it, okay? You can really help your city when you do something like that. And for everybody else, remember our restaurants with their closing down somewhat, it's going to be hurting them again. So if you can support them with takeout, gift certificates, leave big tips, that will help our restaurants in this time that they're moving through with the pandemic. All right. So it's on us. We can control it. Thanks everybody for checking in. Please get the word out about how to keep our city safe and healthy. Take care.